side. ठीक है, so
मेरे ख्याल है थोड़े से I think maybe we can begin in about a minute. Meanwhile, thank you very much, Dr. Wes. आपके आने का बहुत शुक्रिया. Welcome to EE100. और this is a smallish section. इसमें इतनी enrollment ज़्यादा नहीं है. ये आमतौर पे वो students हैं जिन्होंने पहले साल के अंदर ये EE100 नहीं लिया था. तो they are of various majors और कुछ थोड़े से advanced भी हैं. But nevertheless, when I saw your talk in one of the other sort of sections, I thought this would be an excellent sort of material to share with these students, and they have been learning quite a few things which are somewhat related, और वो भी इन चीज़ों को देख के उनको ज़रा समझ आ सकेगी कि in very complex engineering systems ये जो basic concepts हैं वो कैसे extend होते हैं. तो I give the floor to you. आप kindly you can begin. Students जो हैं voice से join भी करेंगे और थोड़े से, and you can take up to 30 to 40 minutes up to you. और उसके बाद अगर दरमियान में भी क्वेश्चन लेना चाहें, you can do that. एंड में लेना चाहें, it's entirely up to you. Good luck.
Thank you very much for the introduction and also for the invitation. Basically, it's somehow honor for me, and also nowadays it's more relevant to talk about biomedical electronics as compared to past. So I will just briefly start. So what I'm going to elaborate is basically what currently we are doing, and I'm not going to go at a higher level. I'm going to go at a very much lower level, and what I normally call next generation of biomedical electronics. Right. So that is my research area too. That is my bread and butter too, and that is what I'm motivated to, and that I feel that is somehow at least part of the future which we need to invest is somehow in the electronic side, and specifically in the biomedical when I talk about healthcare. So I'll start with the bigger picture. So we normally work in the area of multiple, I would say, themes. So the first and the main broader theme is the neurofeedback. So which is somehow relevant to our healthcare system. If we see our healthcare system, what happens in our healthcare system, we go to a clinic, we go to a hospital, we have some symptoms. The doctor do some interview, they take some response, they advise some tests, and based on the tests or based on the interviews, basically they gave some medication. So that's, for me, that's doing an interview is basically they are analyzing you, and then giving some medication is basically some sort of feedback. And then they do this process repetitive. Most of the time they say, okay, visit me after 3 days if the symptoms remains, or come after a week, or follow up more often. So that's a feedback system. So what I want, or what we are looking for, okay, for those applications for which we don't have to go or frequently to hospitals, why not we develop such systems, and we call them as a neurofeedback systems. So we are currently working on those systems. The things will be a little bit get clear as we move on, but you can take an example of an epilepsy, जिसको हम मिर्गी कहते हैं commonly. मिर्गी में क्या होता है कि the person is normally fine, he is doing his normal activities, but sometimes and often he has some attacks. वो attacks किस किस्म के होते हैं? That can be minutes attacks, can be like a 1 hour maximum, or even seconds attack. But during that attack, he will lose his conscious. He might fall down, something will come out from his face, he's not conscious, and that's disaster. वो जो छोटा सा brief episode होता है, that has a bigger impact on his social life, on his economical life, on his journal life where he is growing up. So what we aim, why not we somehow detect that small episode whenever it's going to come and try to remove that from his life. अब वो जो episode होती है, that varies. For some persons might be that will come once in a month. For some persons might be it will come once in 6 months. Might be that is not that much dangerous. But for some persons it's weekly, it's daily, and that's disaster for them. I would even say even that episode which comes 6 months, once in a 6 months or once in a month, that's also disaster. Why? If, for example, that person, he's doing a swimming or he is walking on stairs, and that episode comes and he fell down, that's a fatal for him. That is a disaster situation for him. Similar thing, he's a driving, also that's a fatal situation. In US or in Europe, European countries, also they have like check that, okay, are you epileptic, or you which level of epileptic? So you might not be able to get a driving license. So that's why for those systems, specifically a neurofeedback system, where you can give a feedback at a runtime by detecting the disorder before its occurrence, is very much helpful. And another application is autism, where like a child might not need some learning help. Means he's focusing, but he is not able to get what is being taught to him. So the simple example is here, like somebody is teaching you, okay, what is even the squares, or what are the quantity of those numbers, 2, 3, 4, but since your mind is not taking them, and you get frustrated and you will blast. But if something is you are detecting those particles when you are going to blast, or why you are not understanding, and give some medication, give some stimulation, change the behavior the way you are doing, like giving some sort of real-time feedback can help the person a lot. So that's the whole idea. I'm again not going into the details how we are doing, how the circuits are being happening, how the electronics is being running, but I'm talking about the abstract idea, what our goal is. The second thing comes when we want to develop such systems, we want such system that we can wear them. If we want to wear such systems, those systems should be of very much small size. So the same terminology which we use smart lockdown, we also call them smart sensors. So those sensors, whichever, they should be smart enough that the person can wear for a longer duration. When I am talking about a longer duration, you can see that for epileptic patients, that longer duration is weeks, is months. Okay, you can replace them, but the replacement time should be at least a couple of weeks. You don't want to replace those devices or those sensors that much frequent, and they should also be washable. So these are the things which are also we are working on for smart sensors, for ECG, for EEG, for any disorders which are considering basically the physiological signals and which is having a contact with your skin. The third application which we are looking into is, instead of, apart from using these which diseases or disorders, which we normally call chronic, which needs long-term continuous monitoring, we can also look for those applications which just needs, might be one time in 6 months checkup regular, but that is essential. And because of some stigma around our society, because of lack of facilities, that's not happening. For example, the prime example is of breast cancer. Means how many of you have your mothers, your sisters, your grandmothers ever even went to hospital for a mammogram just for screening? That's very much common, or that is at least is advised for any woman after 40 years to do, after like at least after 6 months or a year, to do those things regularly. Why? Because if there is some abnormality coming on, if you can detect that abnormality at early stage, you can cure it, unless it expands into your body and becomes a disaster. So what we are proposing to, or what we have basically developed initial versions, to have a portable device which a female can use in her house, doesn't need any support. The device will just give an early alarm that, okay, you should visit now a doctor. You should visit a health specialist. There are some things wrong. Might be the accuracy is of 70 to 80%, but at least it's pushing you, it's giving one step ahead that, okay, there is some abnormality that might cause, and you should seek for help. So that's what we have developed a system which is based on thermograms, and that's also used for detection, and we have included all the digital backend, how we can detect that thing. And on top of it, we also seek to work in the energy harvesting, since when I'm talking about operating things, these smart sensors for a longer duration, we want to operate them. And how we can operate them? Using batteries, using cells, that's one way. But how much? The battery is also going to carry some weight. The battery is going to be huge. The battery needs replacement. If you specifically talk about implantable, then you have to do the surgery and take the things out and replace the batteries, just everything else is fine. So why not use energy harvesting? Why not use your motion? Why not use your sweating? Why not use the solar? Somehow get or harvest the energy from your environment to run those sensors. So that's some area which like somehow my dream to implement that thing. But at this moment, this is some area which like I preliminarily want to work, but need some more further support from the students. So, but that's the overall which I call next generation of healthcare system. And again, this is one dimension. There are a lot other dimensions to these next generation of healthcare system. This is the dimension which I am looking into it. But again, we cannot live alone in our society. And I call these as next generation of healthcare system. So the basic motivation why we are working on these things is basically the chronic disorders, which is the leading cause of death. If we look around 30% of these disorders or the deaths happening is mainly because of the cardiovascular diseases. Right. Okay. Just a minute. Man, I guess the wrong slide is being. Okay, I will just change it. Is it fine now? I guess that should be fine now. So there are duplicate screen and there was an issue. So if we just talk about the motivation, that motivation is mainly coming from those disorders which we are facing in our real lifetime. So the main is basically the cardiovascular diseases. Then we have a brief of neurological disorders. We have the cancers, and then the lies, the glucose, the sugar, and all those other aspects. But if we talk about why, because since a lot technological advancements have been happened in past, I guess, 2 or 3 decades, but still we are at the same pace. Like the chronic disorders or the deaths because of them is on the rise, and we are still not able to cure them. The reason somehow lie if we see a little bit more towards the overall configuration of these disorders. For example, the cardiovascular disease is not a simple disease. It has a combination of a lot of symptoms. It can be stroke, it can be coronary heart disease, it can be heart failure, it can be deep vein, it can be angina. Previously, we just used to have, okay, there's a one thing known as heart attack. But now we all are familiar with a lot of terminologies, which 30 years back, we just have one terminology, okay, he has some issue in his heart. So that's why we need to look into all of these things and if to understand, and then we can only do the cure. The second thing comes the neurological disorders. And the neurological disorders the same. It's not only one disease, it's whole spectrum of all different disorders, ranging from epilepsy, OCD, depression, Alzheimer, autism, blindness. All of these are there, and each individual has their own patterns. Each individual has their own symptoms, and each individual is going to have its own cure path. So that's why it's not that much simple, and because of this not that much simplicity, we are yet not able to solve those things. And our the conventional pharmacological therapies, meaning the pills which you take, have limited efficacy. Means normally we say, okay, for the chronic disorders, 30 to 40% still remain unattended. Then talking about the surgical therapies has good efficacy, but again, they are limited. You cannot do surgical therapies for very much simple scenarios. If you have, let's say, in a small part of your brain is causing that epileptic seizure events to happen, you don't want to go and just remove those, because it has to have a deep brain surgery, and that can be fatal for your health, and nobody want to do unless something is that much annoying. Definitely you go for it. So the surgical therapies though have good efficacy, but they have their own limitancies. So these are basically the main motivation that we need to look into it, and that's somehow linking with what we as a EE have done, since we all are talking about electrical engineering and something which we didn't do, we should have done in past. So for me, like first wave in EE was from the computation. Now you all have gadgets. You are using those gadgets. You have enormous amount of data which you can just plug in and you can play around. And that's great because we did effort. We did like 20, 30, 40 years back. We did effort and we got what we wanted. We have some vision in our mind and we have achieved that thing. Same thing happened with the communication. You have the best case of communication. I still remember means when my brother went 10, 15 years back, there was no set. We just have the Skype call, and the Skype call also was not that much stable. But now we have great communication links. Again, we are talking even based on those links also. So those things were done because that was something we need, or we felt there is a need. But we never felt that healthcare is a need. We all the time thought that, okay, we get old and then we have to die. We never felt, why not we improve those facilities? And people start thinking towards the, okay, now we need to think over it in an innovation manner, not just bringing those devices which are all the time in the hospital and making them more fancy or making them more robust. No, thinking beyond what we can do. And that's something which I'm calling a wearable or implantable medical system. So we need to work on that thing. And that's like, you call them revolution, you call them next generation, you call them something futuristic, but that's somehow we need to look into it. And that's come out healthcare. If you see in a hospital, in a clinic or hospital, you go for a chest pain, they put a lot of ECG around your chest, a 12-lead ECG, and they are going to measure your vitals. Okay, they might say, okay, now do this thing for a fortnight if you have continuous chest pain, and then they say, okay, we can propose some medication. But if you have a time machine and you go back 40 years in past, you will do the same thing. Doctors will do the same thing. You go to hospital with a chest pain, they will plug it a lot of electrodes, and then they will measure your ECG, and then they will propose medications. So their issue is happening. Like 30 years back, we are doing the same thing, and we are in the future, we are doing the same stuff. We have these portable applications, the portable devices, which, okay, make a person run on the machines to have the improved versions, but still we are relying on those all factors. We have to go to the hospital, a clinician should be there, a technician should be there, they have to measure our vitals, and then some process has to follow. We are not relying on the technology. We are relying on the technology as a sport, but we are not relying on a technology that should assist us. So that's something which is missing, and that's what we are working towards it. And why we are working towards it, basically the disease has to tell. It's not like for, I have a headache or I have a simple joint pain, which can be just cured by a medicine or a painkiller, and I have to go for a wearable device. No, the disease has to talk. That's what I was saying initially. A cardiovascular disease is not one disease, it's a combination of multiple phenomena. You need to understand each and individual, and then you should process it. That's why the disease has to communicate. For example, if we see a diabetic patient and his glucose level for 24 hours, which is spanned in this slide. So what's happening normally, if you know any diabetic, most likely you might have, if not in your family, you might have seen, or you might know that they normally use the finger prick method to measure their sugar level. And based on that sugar level, they control their diet, or if needed, they take insulin. So normally the common routine is that they take 2 hours after the lunch, 2 hours after the dinner, or 2 hours after the breakfast, or everyone has their own routine. Someone before the breakfast, they do like with fasting. So they follow some pattern to get an idea about their glucose level. So here is the glucose pattern of one person. He did like around 7 a.m. and then he did around 8 p.m. What happens, he found out his glucose level is quite normal at point A and at point B, and he's happy. But in reality, what's happening in between, when he's not measuring his glucose, the glucose level is very much high. It's even the dangerous limit. And that's causing him fatal, and that's causing his life in a disaster situation. If at this moment we have some continuous glucose monitoring device, which can monitor his glucose level all the time, he can tweak his routine just by changing the diet or by having some movement. He can just improve his health a lot. So we need to have wearable electronics. And that's why, as I was saying, the disease has to tell. Here, the glucose is basically one of the basic disorder or sugar, which basically needs continuous monitoring. Epilepsy is one of them. Cardiovascular diseases, some specific types are one of them. And that's why the 4 P's of medicine, which basically National Health Institute already provoked, like 20 years back, all the medicines should be predictive. Your medicines, even the pills, they say they should be predictive. They should predict what's coming on. They should be personalized. They should be personalized to one person. Means when you are taking a medicine, it's not like I am taking a medicine of a brufen. The brufen for person A should be same as person B. No, there should be some variation at least. It should be accustomed to my needs, how much amount I need. And I'm giving a pill as an example. We should do something beyond that. Preempt, it should be able to preempt also how the things are moving on. And the main and the top thing is the participatory. It should involve the patients, that the patient should be able to participate. I am a patient, I should be able to participate in my health juncture. The same way I give an interview to the doctor and doctor do medication based on that, or predict advise medication based on that. Similar thing, whatever I'm taking medicine, there should also be some mind involvement. So technology should also support that thing. And that's why people are working in this 4 P's of medicine, and that's pretty much common. And also linking the things with the same thing, the wearable electronic is something not new. People start thinking towards this thing, I would say 50 years back, though they were not able to combine because of a lot of factors. Motivation was minimal, interest was not there, but they start looking into it. And one of the famous example is basically the guy here. I don't know any of you know this guy, but he is the famous person. The name might be familiar with some of you, is a Holter. So if you go with a hospital, as I was saying, for the ECG, they measure your ECG in a one night in a hospital, and then they give you some device also. And that device is a bulky device, somehow like this device, and they put again electrodes, 5 electrodes to your chest, and they tell you, okay, take this device, go home and come back after 24 hours and give us the data. That device is known as Holter monitor. What it do, it continuously try to track your ECG patterns, and based on that, doctor tries to adopt okay, what's happening. And that's something similar जो हम लोग बात कर रहे हैं about the wearable electronics. We want to do the same thing, but without making the person suffer, without suffering him. The Holter, how he started, he just put all the ECG machine which was in the hospital and plug on him and start driving the bicycle. The idea was that if you go in a hospital in a resting environment, the ECG patterns are most likely going to be normal if you are a cardiovascular patient. But doing your work in a normal routine without any uncomfortness is something which we want to achieve. So he started from here, and then people looked into different versions. Okay, this is a funny picture. He's bringing his PC and acting as a laptop, acting as a gadget. So that's what things start moving, and we have did a lot advancements. People start shrinking the size. They're bringing the gadgets down. They make the wearable boards. MIT has a significant amount of contribution. CAIS, Georgia Tech, all those universities have their own contributions. They've worked hard to bring those devices, shrink them down. But still, the major issue is that we don't see much devices around you. There is a lack of these devices. You don't go to the market apart from one thermometer, apart from a blood pressure monitor, which you can intermittent monitor. You don't find these devices. You have these devices in the form of Fitbit, which can track your fitness, but they don't. We don't have like a medically reliable data which you use for your own medical diagnostic, or doctor rely on them. No. So there is basically twofold problem. Definitely, the doctor also have to jump into it. They also have to realize there is something missing. But these devices most likely are in the research phase. That's why I'm saying this is like one of the exciting area, because things has to yet come out. There's no products, or like very minimal products which are acting as a wearable boards, wearable devices. People use them for the research purposes. They remain in the lab. They don't come out much often, because a lot of effort is required even after the lab system. So we are working towards also those things. And how my area linked with that, or how electronics is linked with that, is basically this device miniaturization. When we want to monitor things for a longer time, when we need to make them small, we cannot work in the discrete component. जिस तरह आप resistor, capacitor, breadboard पे या PCB board पे लगाते हैं, components लगाते हैं, you cannot do that thing, because that will in any case will be bulky. We want something the way your mobile phones are made. We want something where your processor is made, and which we normally call integrated circuit design. Like an ICs, we want to work inside the ICs, how the amplifiers are working, how that processing is happening. And then we want to operate them with a very much small power. So we call them a low power operation. And that's something which I call my naturalized medical device. So we have worked on this ECG device somehow, which is like a patch sensor. Now we are working on the modified version of these things. So it's going to have an analog front end. Analog front end meaning it's going to acquire the analog signal as the real-time signals are analog. Then we want to digitize. Since we want to digitize, and the best way to digitize at this moment is in the digital domain. Now even the analog processing is again bringing a lot of interest because of the machine learning and the deep learning. And then once we have detected the signal, we want to communicate to the doctor, to the caregiver, and any one, or even the patient itself. And also there should be some neurofeedback. So we want to do stimulation. Stimulation means you need to update, you need to do some electrical pulses, you need to take some medication, whatever, any sort of stimulation which is required to save the person whenever an abnormality is detected. And in totality, what I would normally say, we want to have the same impact which we were having in a clinic. So आप hospital में जाते हैं, you get like all type of facilities. We want to mimic the same behavior in your house. So we normally say a biopotential signal acquisition, a feature extraction, classification, and recording or stimulation. So we should have all of these things. If you take an example of an ECG, जो एक common हम जिसको link कर सकते हैं. So for ECG, we normally have a biopotential signal acquisition, meaning हम लोग जो signal होता है उसको acquire करते हैं from your chest. We connect electrodes. Electrodes are transducers which are going to convert those potentials into electrical signals. Action potentials को electrical signals में convert करते हैं, and we use basically an amplify those signals ताकि हम उनको इस form में ला सकें so that we can digitize them. And that process is known as biopotential signal acquisition. For example, अगर आप यहाँ देखें, we have these electrodes. So there are 10, 12 electrode systems available for ECG. So these all are electrodes which are connected to your chest. And these are the ECG patterns. Okay. And based on these ECG patterns, we try to detect कि अब हमारे पास जो heart rhythms हैं, are they fine? Is there any abnormality or no? And based on that, we try to do the decisions. We have multiple EEG variants. Some are 10 lead systems, some are single lead, some are double lead. But again, based on requirement, we adopt that. Then the second one comes the feature extraction. If I talk about so then we have the feature extraction. Feature means we extracted huge amount of data, but we don't want all of that data to be processed on our chip, because हम लोग अब बात क्या कर रहे हैं, we have a very much small chip. एक small IC है जिसमें जो data acquire किया था, we need to process. So we cannot process all of the data on a chip. क्यों? क्योंकि अगर हम सारा ही data उस पे process करने लग जाएं, we are going to use a lot area and we are going to burn the power. So we don't want to do these things, since both of these things are crucial for us. We want the device to be miniaturized and we want to operate at a low power so that we can operate for a longer time. So हम लोग terminologies use करते हैं feature extraction की. We need to identify those features which are important. For example, in the case of ECG, for heart disease, we have some features known as R2R. Peaks, meaning जो आपकी heart rate होती है, उसकी R peak to R peak का distance हम लोग find करते हैं, and that tells you some information कि आपका heart rate कैसे चल रहा है. तो आपका heart rate होता है, that is basically distance between R to R peak. ये R to R peak है, ये एक मिनट में almost 60 to 70 आपके पास R pulses R peaks आ जाती हैं, and that decides how much is your pulse rate or how much is your heart rate. Then there is a P wave, कि जो P wave है इसका amplitude कितना है. Again, there is a QS wave, उस QS wave का amplitude कितना है. There is an S wave का amplitude कितना है, उसका duration कितना है. So all of these small things are going to bundle up, and you are going to decide कि आपकी specific abnormality में which are going to pour into. Again, there are a lot features, and you have to decide as a designer with coordination with a medical specialist कि एक specific abnormality को detect करने के लिए what type of features are important, and that's what we normally do. Once you have detected those features, then you need to classify, and we want that classification also on chip. Classification मतलब डॉक्टर के पास डेटा आ गया है, डॉक्टर के पास ECG आ गया है, डॉक्टर ने देख लिया abnormal pattern है, and then he's going to say, okay, there is something wrong. So we want that thing to be done also on chip, and that we normally call classification. Whether जो आपके पास patterns आए थे, are they abnormal or normal? So we use basically all sort of classification. They can be machine learning, they can be deep learning, they can be simple threshold based, or they can be just simple decision. कोई आप binary trees की form में कुछ भी decision हो सकता है. But again, the disease, the disorder has to identify what type of classification is required, or normally we call data has to decide what type of classification is required. And the final and the last is recording or stimulation. जिस तरह मैंने पहले कहा था कि recording या stimulation means some sort of feedback. Recording matlab you record those ECG patterns, you record your abnormality pattern for later use, for later feedback from the doctor, because we cannot take the doctors out from the overall equation. We want to facilitate them. We want they can reach to the disease detection as early as possible so that the person can get cured. And then we also want the stimulation. Stimulation can be in the medicine, stimulation can be life change, stimulation can be some electrical stimulation, some optical stimulation. Now I will give a little bit brief about the common signals which we use in basically hospital environment, or which we basically use for our normal daily life. So the common signal types are the contact base are where the electrode is connected at ECG, electrocardiogram, which I just mentioned, mainly used for the cardiovascular diseases, all type of. There are others too, but I am just talking about at this moment ECG. Then we have electroencephalogram, EEG, used for the neurological disorders, mainly for the non-invasive purposes. We have also further categorization, which I will just mention. Then we have electromyograms, EMGs for the muscle movement, and also used for a lot fitness one. We use muscle movements to detect them. So all of these are being used, especially for the knee injury. EMG are very much important nowadays. Orthopedic surgeons rely a lot on EMGs when they see how your muscle movement is, or even for the the sports persons, or even for the bowling, they use a lot, they rely on these EMG signals. Then there's another categorization that is an contactless, meaning when there's no direct contact of some stuff or some electronics with your body. We normally called optical detection. So you pass some light through your body and you're going to observe the pattern. So we normally call photoplethysmography PPG signals, and that's pretty much in nowadays. They are used for a lot of applications for asthma patients, to monitor oxygen concentration, which is common nowadays. I normally do for my parents just because of the COVID and all of the other symptoms. We measure this SpO2 for children. Previously, we used to do it because of smoke. This SpO2 is a common thing. Cardiovascular, again, because from this PPG signal, you can also measure the heart rate. We normally call pulse rate, and you can also measure the pulse rate variations or heart rate variation. That is very much important, how your heart is behaving. Then comes the blood. You can measure the blood pressure, and those wrist ECG can also be used. So these are something which are, again, more on the research side. People are working on it. Also in our group at LUMS, Dr. Wala is working explicitly on PPG. She has developed a glucose sensor, which is based on this PPG and can measure your glucose values. And they have did pretty much good demos for that one. And now they are moving toward the next step of taking into more portable form, because at this moment it's more on the lab testing. As I was mentioning, there are a lot of steps. First step is you have to make the prototype in a lab environment, and then you have to deal the next steps. कि आप इसको छोटा से छोटा कैसे करें. And then this is also linked to current scenario when we are having the COVID-19. So the SpO2 is very much important. The respiration rate is very much important. The heart rate variation, जो एक normal चीज़ है जो hospital में एक COVID-19 के लिए उन्हें चाहिए होती हैं. All of these things can be easily done through PPG. इसलिए मैं कह रहा था कि जो next generation of electronics है, that is very much important. That's relevant to what's happening. If we have invested a little bit time earlier on these things, we might cope the situation more better. Because COVID-19 में the biggest issue is, apart from getting the vaccine and all others, is basically taking care of the patients, seeing how they are going, seeing their progress and doing accordingly. Because we don't have vaccine, we don't have proper medication, but we can at least monitor them to avoid the worst situation. That's why ये current situation के साथ भी a lot relevant है. So that's what I will highlight the main things. Coming back to the biopotential signal acquisition, we have multiple categorization. We have ECG signals. अगर हम ECG signals की बात करें, you go to the hospital, they connect electrodes, and somehow the waveform look like in this fashion. अगर इस signal को हम लोग देखें, इस signal के जो amplitude होता है, that is in the form of millivolts, frequency in the form of 100 hertz होती है. Then we have EEG signal. EEG signal में we have multiple types. We have EEG, which normally we call the scalp EEG, जो आप अपने surface के ऊपर से लेते हैं. Its amplitude is in the microvolt range, and then frequencies under hertz. Then comes the local field potential. Local field potentials होते हैं if you take from your neuron. आप एक needle लेके अगर आप neuron level को touch करें, that is normally called a local field potential. उसका amplitude ज़्यादा होता है. That's more beneficial in detecting the disorder. But the issue is that how you are going to have that needle, design that needle and touch that neuron level. So that's again a daunting task. So there is no free lunch. या तो आप अपना signal अच्छा ले लें, या आप उसको signal को detect करने के लिए mechanism अच्छा कर लें. And then there's an ECOG electrocardiography. That's basically you go under the skull, but you don't go to the neuron level. सिर्फ आप थोड़ा सा layer नीचे चले जाते हैं. And then there is also minimally invasive. वो skull के अंदर नहीं जाता, वो skin से signal ले लिया जाता है. It helps in basically motion artifacts, but again you are getting a bad signal quality. लेकिन normally the most common is EEG, which is the non-invasive version. So it's being used a lot for a lot of applications. आप hospital में जाएं, they measure your EEG signal. It's a superposition of all the signal, but still it's being used a lot. So again, जब आपके पास signal आता है, उस signal की आगे electronics आपको, that's the main daunting task. ये जो मैं amplitude show कर रहा हूँ, you can say they are very much small amplitudes. They are overall overwhelmed with noise, and because of very much low frequency, there are a lot of issues which you need to deal at the front end side. Then comes the PPG signal. जिस तरह मैंने कहा था कि PPG is a non-contact method. So what you do normally in the PPG, you basically pass some light through your finger, as shown here, right? And the light is basically passed through your blood vessels, and it reflects back. Either it reflects back or either it transmits to the other side. So whichever the way you want. Either you can put the both light and the photodetector on the same side. If you put both on the same side as depicted in this diagram, then this is normally called reflection mode. In the reflection mode, you observe how much oxygen got absorbed by your blood vessels. Why? Because whenever those fluctuations happens in your ECG, so the contraction and expansion happens. And whenever this contraction and expansion happens, in the contraction phase, less blood is going to be absorbed. In the expansion phase, more blood is going to be absorbed. So you can have this pattern which is shown here down. And this is normally a common PPG signal. So it has systolic corresponding to your systolic blood pressure, diastolic corresponding to your diastolic blood pressure, and these peaks, this interval is the same thing as ECG R2R peaks. So you can have a lot of information from these PPG signals. Commonly, हम लोग अभी क्या करते हैं? You go into the hospital, they plug in this finger clip in your hand to measure your SpO2, to measure your heart rate. घर में भी हम यही कर रहे हैं. But what we want to expand it. Expand किस तरह कर सकते हैं? By incorporating more signal processing, by incorporating more hardware in it, so that we can detect the blood pressure, so that you can monitor for the long-term monitoring, you can have your glucose value, you can have your respiration. So all of these things can be embedded, and it has that feature in it. So just to overview about the transmission type, कि आपके पास जो light source होगा, LED होगी, it should be here, and another LED is here on the opposite side. आप photodiode embed कर दें. So then that's going to be a transmission type, meaning the light is going to transmit through the cells, and from the other side, you're going to observe it. The opposite scenario comes the reflection type, जो मैंने अभी बताया था कि light is going to pass through and then it's going to reflect back. अगर आप photodiode इस तरफ रख दें, and you can observe again, यहाँ से भी transmit करेगी, but you are not putting any photodiode on this side. And once you have this photodiode क्या करेगा? It will convert the light signals into an electrical signal. जब आपके पास electrical signal आ जाएगा, then you can use electronics to as a integrated circuit design. मेरा काम होगा क्या? We can use this electronics to design circuits ताकि मैं उस signal को detect कर पाऊँ. The underlying principle is basically कि ये होता ये है कि for oxygen concentration what we do, we normally use two light sources, different wavelength के. Normally हम लोग red use करते हैं wavelength और एक infrared use करते हैं, because at different wavelength different light is going to be absorbed, and based on the ratio of those different absorption of light, we try to find the oxygen concentration in your blood, which is basically nowadays all SpO2 जो measurements हो रही हैं वो इसी तरह हो रही हैं. It's just like ratio of division by divisions हो जाती है. So we try to find this. अगर आप spectrum देखना चाहें, this is spectrum recorded in our lab for different wavelengths, and these two wavelengths give you the best of all the features. You can observe other wavelengths too, but the interesting thing is that not only the finger works, you can observe the same behavior for any part of the body. Finger is more easy, that's why it's used a lot, but it's affected a lot by motion artifacts. People have used the wrist a lot to measure the wrist. So आपके Fitbit की devices होती हैं fitness की, they are basically using the your wrist. And similarly, people have used earlobes, क्योंकि earlobes में आपके पास again motion artifacts काम होते हैं. You can have a device which can be used for a longer time. So people have used a lot versions and a lot variations. I have one basically video for the I guess there is some lag time on my slide. So I have basically one video for the non-invasive glucose monitoring and some ECGs one, but I will not play it now, but I will upload on your, I will share with Numan, so Numan can upload on your the link जो भी आपका LMS का है, if you're using anyone else, so you can just watch it and you can just have an idea. Just PPG ka, I guess it's a 1 minute, so you can also see here if it launches. But I will also upload a couple of others which are basically developed at LUMS in EE department. So what's happening here the student is recording her PPG data, and that PPG data is being processed in this a small analog front end and also on the FPGA, and we are communicating to the laptop. So it's just displaying this PPG signal, and based on this PPG signal, the FPGA have some processing and they are detecting the glucose level of the patient. So abhi thoda sa detect karke, their analysis will tell how much is the glucose level of the person, and they also verified this thing from the finger and prick method that the glucose level was on the same range as of the person. But this basically video shows the setup of their system कि किस तरह वो PPG signal एक run time में ले रहे हैं. At this moment again, जिस तरह मैं कह रहा था, it's more like a lab environment, but ultimately हमारा next phase यही है. We want to make it a very much small case. It should be a very much small value. So you can see the overall glucose value is 1115, and then we can later on look into it. Right. So I will share these links with Numan. So the main takeaway points from this talk is that healthcare needs attention in all forms. Wearable electronics is one definitely forum. That's what we are working on. But there are a lot other dimensions which need to be worked on, and we as an electrical engineers need, or even engineers, or even as a scientist, have to work a lot on these things so that we can play a vital role. And that role shouldn't be just limited. That role needs to be expanded, and that has to be done even from our side. Currently, if you see, contribution from Pakistan is very much minimal, especially on the electronics. I will talk mainly from my fronts, because there are a lot of other fronts which are basically have done a lot good. But on the electronic side, the contribution is very much minimal. Reasons can be multiple, but the main thing is that we need to take the initiative that, okay, we also need to play our role, because if we don't play our role, then what's going to happen? The same way we don't have any these industry which are working on the IC design, which are working on the top electronics, is not in Pakistan. If we continue, we are going to have the same thing. We can only just make the fans and other stuff as compared an electronics one, but we are not going to have any state-of-the-art designs. So that's why we need to take these things serious, that okay, whatever the technology is going, that the way the technology is going direction, we have to accept it, we have to absorb it, and we have to excel in it. And we have to accept the challenges. We cannot just all the time remain that okay, that's something which is at least not in our window, which we cannot do. We have to do, and we have to take the lead in these things. So at LUMS, we are trying basically to have some at least in this IC design, specifically in the biomedical design area. So I am working, Dr. Wala is working in this area, PPG work, basically non-contact is her work. She's working in the COVID-19, especially developing such devices. On the front end side, we are also have contact with Dr. Adil. He's working on the processing side. You have, I guess, one guest lecture from Dr. Numan, but he's working on a different aspect, but again, from the point of care devices. So there are a lot forums which at LUMS we are working, and I'm talking only about the EE, definitely the bio and the physics. All departments are working explicitly. So we need to basically combine these things and move forward, so that if any such situation which we are having nowadays in the healthcare, we should be prepared well, and we can take action accordingly. The action should also come from the Pakistan side. Not only we see from the outside that, okay, the vaccine, we are being like somebody is doing tests and we are saying, okay, we are having tests or like this much, but we should also have our own devices. We should have also our own vaccines we should develop. So I guess that something is missing, and you as a Pakistani, or we as a Pakistani, should feel that thing, that our role is something missing from the overall world. We don't have all the time take backseat. This time we have to move toward the front role, and you as a next generation, because you are going to lead. So I would like all of you to take part in those things, in whichever the forum you are, in whichever the dimension you are. As I tell you, this is only one dimension which I am working. Everyone is working in multiple dimensions. So I guess I will stop here, and I will take any questions. And thank you again very much for your attention. And even you can just ask any questions, or you can jump in future if you are interested. Thank you very much.
जी, thank you, Dr. Wes. जी जनाब, कोई questions हैं तो please go ahead. Acha, Wes, maybe I can maybe just ask a question or two. Meanwhile, students are trying to sort of digest कि जो आपने दिखाया है कि ये जो सारी effort है. I mean, other than your graduate students, are there any undergraduates who have been involved in this? और क्या opportunities हो सकती हैं undergraduates खास तौर पे of non-EE background to get involved?
Basically ना, basically what we normally do, जितने भी जो projects में एक दो दिखाए थे, ECG वाला, PPG वाला, we normally, for the discrete component design, when we have first prototype ready, we use it as an S project. They all are final FYP, final year projects. So जैसा वाला का भी project था, they were basically group of students. They worked previously. मेरा भी जो ECG के थे, I have 2 or 3 overall final year projects. जिन्होंने ECG initially they were front end, कुछ back end पे थे. Currently also I have one student working on the EE1. So they all are like the pehla version hota hai for the prototype. They all from undergrad. At this moment, they are more from the EE, but definitely a lot other features can be embedded, because now I'm also working like for the electrode design. अभी हम लोग जो अभी normally electrodes पे बात कर रहे हैं, they are more conventional electrodes, which are silver electrodes जो available market में होते हैं. But these cannot be used for long-term monitoring. So they are basically the chemistry people. Definitely they are required. The data side पे है, a lot people from the bio or from the CS people definitely can be jump in. Manipulation करते हैं, अगर कोई math department के हों, they can also pull in. So there are a lot definitely features where the other departments can come in. But at this moment, definitely this work is from undergrad students, but mainly from the EE.
Very good, very good. ठीक है, कोई और अगर कोई क्वेश्चन या कमेंट है बिफोर वी लेट डॉक्टर अवैस को?
I would like to add another thing there, Adar. अभी जो हम लोग एक एस प्रोजेक्ट अभी है, they are working basically मैं और डॉक्टर नदीम है उसमें involved. So a group of students, they are basically collaborating with the Shalimar Hospital, Lahore. So we are trying to have neurologists से data seizure का data हम लोग अपनी database create करें. So we are trying to do that thing. क्योंकि अभी ये होता है कि जितनी भी databases available होती हैं, जितना भी data होता है, we don't have information about the type of the seizures. So we are working on that one dimension, how to incorporate the types. So उसके लिए we have to have our own data. So we are also working on that. So उसमें भी the final year students are involved. थोड़ा सा limited है आजकल because of COVID. We have bigger aims, but now I guess we have one question. Please go ahead, Mubashra.
Yes. So I wanted to ask that how long before this kind of comes into the market and it comes into use?
That's something like I don't know. That's a difficult question, but that's what we are working on. We have normally what I can tell you what is our design cycle. We do some first prototype so that we get some confidence from the local doctors and get their vetting. And then we go for IC design. We go for a very much small system. And then again, that is a lab version. So the IC design process takes 1.5 years. Since like you need to do the design, then you send for the fabrication, then the chip comes back, you do the board, you verify it, and you make sure everything is working fine. And then if everything is fine, then you can go for, let's say, commercialization. In a sense, you can go for a market partners and you can pitch to them. And then from that onwards, they have to take, in a sense, because there is a lot of approvals are involved. Whenever something is related to the medical, there are approvals which are going to be involved from the whatever your approval agencies. In Pakistan, we have DRAP. So जिस तरह आपने अभी देखा होंगे जो ventilators के थे, the DRAP has to approve anything. Any vaccination has to get approval. So I would say normally 3 to 4 years can be a good amount of time if you don't have much lags. But that's what we are aiming for. So there is another question, are these innovations going to be feasible in terms of cost? Will they even be available for the normal population? Seeing medical instruments are rather costly. The whole idea about these wearable devices, they should be cheap. जब हम integrated circuit की बात कर रहे हैं, integrated circuit आप एक करेंगे, that is going to be expensive, but we want these devices to be 2,000 to 3,000 rupees or even less. And then they are not going to be something जो आप एक test करवा रहे हैं, that is something with you. आप जिस तरह thermometer लेते हैं, तो thermometer is something similar. जब आपके पास blood pressure का एक instrument होगा घर में, that's 2,000 or 3,000, 4,000 rupees, but then that is there for you. So the cost is, I guess the main benefit is going to become of cost in these ones. You go for a normal one doctor visit, it costs 1,500, 200, 2,000 rupees. So the cost benefit is there जब आप mass production में जाते हैं integrated circuits में. लेकिन वो काम अगर आप local करेंगे तो, so then there is huge amount of benefit you are going to see.
Excellent, excellent. और किसी का कोई सवाल है, comment है?
Single stethoscope cost. I don't know about the price of stethoscope, but still, if even single stethoscope costs 10K, but that will remain. We have in our house stethoscope, I guess when I was 7th, 8th grade or even lower, I don't recall. That's the law, because I measure my blood pressure of my parents almost every day or like a couple of times in a week. So that works fine. So even if that 10K investment, if you go for like 20 or 30 years, that's not bad. मैं compare कर रहा हूँ, you go for a one visit to the doctor, you do one like a blood test ही कर लें, how much it costs. So that's why something which is recurrent is bad. Something which is going to stay, even if you have to put something, it's not that much. But again, these prices, when you do some local manufacturing for the IC design, yeah, mass में करेंगे, it's not going to be that much. I guess we have another hand raised. Just a minute. I mean, if somebody else, I cannot see the hand. Yeah, please,
Afnan, go ahead.
Afnan.
Afnan, go ahead.
So you talked about, the IC designing or everything being implemented in Pakistan, like huge industries being set up, state of the art and everything. Do you think we can ever catch up to the extent, what China and Taiwan or other people are doing, because, they've invested a lot, and I think we're, left behind काफी हद तक. So is it even possible to go through this route and invest in IC designing in Pakistan?
Yeah. It's the answer are twofold. Yes, definitely we can do. We have to catch up India did it, we can catch up. We don't have to bring foundries. Now अब आप ये भी बात करें, यूएस में भी आपको नई फाउंड्रीज नहीं लग रही होती, फाउंड्रीज जहां आईसी डिजाइन नहीं होना है, बट दे नीड द डिजाइनर्स जिसने आईपी, द वैल्यूज ऑफ आईपी, आईपी मींस इंटेलेक्चुअल प्रॉपर्टी, जो आपने डिजाइन करना है वो डिजाइन एक कंप्लीट सर्किट की फॉर्म में उन्हें भेजना है, दैट हैज वैल्यू. सो वो आप यहाँ बैठ के कर सकते हैं, वो हम लम्स में बैठ के कर रहे हैं. दैट व्हाट वी आर डूइंग, दैट इज समथिंग व्हिच इज मिसिंग. हम हमेशा इस चीज में रहे हैं. आई वाज आल्सो इन अंडरग्रेड द सेम थिंग. वी वांट द फाउंड्री टू कम. फाउंड्री का कोई फायदा नहीं होगा. फाउंड्री जस्ट लाइक एक आप एक पुराना घर लेके हम ले आएंगे, लेकिन उस पुराने घर में जब तक आप लोग नहीं रखेंगे विच आर बेसिकली इनोवेटिव, जो कि डिजाइन कर पाए, then that's going to be an issue. So we can definitely compete easily अगर हमारे पास designers आए, if we put into it. We don't have to bring money in it, we just need to bring skill set in it. कि हमें थोड़ा सा trend change करना होगा. We have sitting here and doing the design and sending your designs and bringing them back. So that should be the policy. क्योंकि जो costly होता है वो designers हैं, process is not costly then for mass production.
Good question. हाँ, बहुत अच्छे. और
And also
जी go ahead.
I was just saying also, like हम लोग अभी ये कहेंगे कि अगर हम अभी भी ना करें, क्योंकि there is a long leap we have to do, then after 10 years we will not have any mark. अगर हम अब start करेंगे, we will have mark in 5-6 years. Why not? Previously there was no. Nowadays there is a big mark at least start coming in Pakistan. I joined LUMS 4.5 years back. Means my area is IC design and there was nothing in IC design that moment. Now I can see like 4 or 5 universities diving into IC design, 2 or 3 companies, government institute coming into the IC design. So what else we want? That is a lot ecosystem already being developed. So I am hoping this to flourish basically, and the flourishness can only happen when we have students remain here. We have very much good IC designers. Intel mein aap jaएं, we have very much great IC designers from Pakistan, but they are there.
ठीक है जी, थैंक यू वेरी मच अवैस. बहुत जबरदस्त. ये दिस वाज एग्जैक्टली व्हाट वी वांटेड. आपसे एक डिफरेंट पर्सपेक्टिव भी सुनना था, और आपका काम भी माशाल्लाह इतना शानदार है कि आई कुड नॉट सॉर्ट ऑफ स्टॉप माय सेल्फ फ्रॉम इनवाइटिंग यू कि वो एक्साइटमेंट शेयर भी करें आप बाकी स्टूडेंट्स के साथ जो है. तो इंशाल्लाह.
Thank you very much. Yeah, thank you. Hopefully next time we can have a different even flavors we can take. Definitely. Thank you very much again for the invitation. It was a nice.
It was an honor.
And even the students, like at this moment during this time, or they are like having questions, so it's also very much motivating. My course, I'm having just a question at this moment time.
Excellent, जी, excellent.
Thank you. I will just share the recording too.
जी बिल्कुल. तो I think now we can have probably a short break. मैं देखता हूँ कि अभी मगरिब का टाइम जो है वो क्या है. If it can align with that, तो वो सबसे जबरदस्त है. हाँ, तो we can have a short break, maybe 10 minutes.